It's Amy Jensen, Geriatric Care Manager and owner of Jensen Geriatrics Management. Today is the second um, episode, if you will, of our monthly Spotlight series. And again, my goal in this interview is to share with the public that the field of aging has a wide array of service providers to help meet the needs of your aging loved one. Each month, you'll hear a short interview with someone who works with older adults, and some capacities you might be familiar with, while others may shed light on a whole new way of looking at things. And today, we're talking with Cindy O'Brien of Comfort Keepers in our monthly Spotlight series. All contact information will be provided at the end of the interview. I'm going to allow Cindy to introduce herself and describe not only her role with Comfort Keepers, but all that Comfort Keepers has to offer. But before doing that, I want to share how excited I am to have Cindy as my guest today. Cindy is incredibly personable and easy to get along with. She's knowledgeable in her particular field and is committed not only to her clients, but the community as a whole. So, Cindy, take it away and tell us a little bit about yourself.
Thank you, Amy, and thank you for this opportunity. It's kind of exciting. So I work with Comfort Keepers Home Care, serving Ventura County and the West San Fernando Valley. My particular role with them is the Community Relations Manager. So it's my job to be out in the community, interfacing with both the consumers who might need caregiving services or other services within the senior healthcare continuum, and then also with different types of providers like yourself, medical doctors, hospitals, the whole thing. And I kind of see myself as the connector. I don't have anything to do with client care myself, but I connect people and resources together. So
Okay.
that's kind of how I view myself. And Comfort Keepers it's a worldwide organization. So it's been around for about 21 years, with this office for about 18 and a half years. And we're purely a home care company, and you'll hear it as home care, caregiving, private duty, but we provide all of those services. It's helping with all of the things that we do on a daily basis, that sometimes through normal aging, through an injury or an illness, something happens where we can't do everything that we do in our daily life any longer by ourselves safely. And so that's when caregiving kicks in.
Well, that leads to a perfect next question. So Comfort Keepers provides in-home care to, like you said, the Conejo Valley and parts of the San Fernando Valley. I think it's really important to educate our listeners on the difference between in-home care and home health care. Can you tackle that question?
Yes, and it's actually, I'm glad you're asking that, because that's one of the more confusing aspects of healthcare, in part because the names sound so similar. Sometimes the names are used interchangeably. They are equally important services, but very different services with very different purposes. So home health care is very much what the name implies. It's healthcare in home. So when we think of healthcare, we think of skilled services, physical therapy, nursing, skilled nursing, speech therapy, occupational therapy, things of that nature, services and that are done by a licensed clinical professional, a nurse, a therapist. And it has to be done under the orders and the oversight of a medical doctor or a nurse practitioner or a physician's assistant. So medical in nature, so services that you might get in a skilled nursing or in the hospital setting, they're being done at home.
Okay.
Being medical in nature, it is going to be covered by Medicare or Medi-Cal and most private insurance. And it's for a specific period of time related to a medical incident. And it could be maybe an ongoing illness and there's generalized weakness, or maybe there was a fall or an illness that's led to hospitalization. It's about bringing in those important healthcare services to help the patient recover as quickly as possible, but in the safety and comfort of their own home.
But that is not what you at Comfort Keepers provide.
Correct. What Comfort Keepers does is home care, which again, you'll hear it as non-medical home care or private duty care, and sometimes just caregiving. So ours is not health care. It's everything that we do in our daily life just to live on our own. So one way of explaining it is if you think about everything that you did from the time that you literally woke up this morning until this moment,
Right.
from getting yourself up, getting dressed, taking a shower, getting food, taking vitamins, medications, taking care of the animals, driving ourselves to appointments or work, whatever we're doing. Those are just our daily activities that we do in life. And again, when an injury or an illness or normal aging kicks in, and for some reason we can't do those daily activities by ourselves safely, that's where caregiving comes in. And caregiving can be a family member, and it can be a friend, a volunteer, or it can be done through an agency. And often agencies come in when that other resource is not available. So a senior who maybe lives by themselves and they don't have family members nearby, or maybe that senior that needs help has actually been the caregiver for their spouse.
Yeah.
So
Yeah. You and your team are actually ideal to work closely with someone like myself as a geriatric care manager, because if you have those clients with no local family or they have limited support, you're automatically in the know, if you will, and can take that extra step to connect them with a geriatric care manager to help tackle presenting problems that are outside of simply home care.
yes.
And, as a geriatric care manager, my clients commonly want to stay at home and age in place. And you just did a great job explaining what services Comfort Keeper provides in terms of independent activities of daily living and activities of daily living. But just for fun, tell me what separates Comfort Keepers from other in-home care agencies.
So all agencies provide the same basic service, and everybody's going to have their own flair, their own specialty. Comfort Keepers, we do have nurses as case managers, and because we've been around so long, we really view ourselves in the community as being a solution provider. So we are here to spend all the time that's needed on the phone with the caller, hear what's going on in their world, and help connect them with the right resource. And it may be that we are referring them to a geriatric care manager. We may refer them to a placement agency. We may refer them to home health, or perhaps home care is the right solution and we are part of that solution.
Yeah, I've always enjoyed working with you and your team because it feels like you take on the bigger picture of just the more so than just the client's immediate needs.
Yes.
So we're going to keep this quick and simple. So I'd like to thank you again. This is Cindy O'Brien. She's joining us today in the monthly Spotlight series representing Comfort Keepers. So Cindy, why don't you close out this interview by telling our listeners how to connect with you and your staff?
So you can call us 24/7 at 805-494-9900, or we can be found at comfortkeepers.com, and you can just stick in your zip code and the office that services you will pop up.
Fantastic. Okay, well, Cindy, thank you so much for your time and for this opportunity to educate our listeners on not only what Comfort Keepers does, but that question, that nagging question between the difference between in-home care and home health.
Thank you so much for letting me be here.
Of course. Thanks so much.